Doctors and nurses of Reddit. What is the worst thing you have seen a patient go through and survive? Not a doc or nurse, but when I had my first spontaneous pneumothorax, on the bed in front of me was a guy with his head swollen 3 times the size of a normal head days later when he woke up. Not like unconscious wake up, but like can open his eyes and speak. He changes a tire on his Audi A4 Combi. When the tire was taken down and the car on the jack, he remembered a screw which made a sound every time he turned the car to the left. So he hops under the car, turns the screw and hears a squeaking sound from the direction of the jack. He turned to it and saw the jack turn to the side while the car fell. The Audi A4 Combi fell from approximately 55 cm in his face. His collarbone saved his life. The car was laying in his face for about 4 hours until his grandfather came to get a drill. He lifted the car with his hands long enough to pull him out. His eye was the reddest I've ever seen. The back of his head was just crunched. He had multiple brain surgeries and had to relearn lot of movements, especially eating since they were forced. To partially reconstruct his jaw on one side I kept holding contact. He is now in his 30s and with therapy he lives a good life as farmer, 3 kids and happily married. Obligatory, not an MD or RN, but I work in psychiatric units and saw an older lady who tried to kill herself by slitting her own throat and failed. So now she just has a huge scar across her neck for the rest of her life. Not the worst I've seen by far, but the one that stuck with me the most. Poor lady. Caution. This is gross. A story from a nurse friend. She worked in an ER. A very heavy-set lady came in with pain in the rectal area. She had an abscess in her perineum, taint, area that was very infected. They began to clean the wound and realized she needed surgery for it, so off she goes and gets the bad tissues cut out. Now the doctors and nurses made special mention of her very poor hygiene as she stunk to high hell when she was admitted, and they tried to teach her the whole wash and keep dry, clean routine. She was in the hospital for a week and was healing up. Well, she goes home and is readmitted about 3 weeks later by ambulance. Apparently she did not wash nor keep clean or dry for the entirety of the 3 weeks. The ambulance guys had to drive with the windows down and heads hanging out the windows. She's literally screaming in pain and can't walk or stand properly. They admit her and she's brought into a room where 3 nurses go to examine. They cut off the layers of blankets, clothes, underwear and never change dressings to see a massively swollen mass of red, yellow, green and black skin that is oozing every sort of fluid humans can make. Basically from a few inches below the navel to a few inches above the anus is completely infected and gangrenous. The woman is squirming around on the bed in pain and keeps sitting up and lying back. The smell is so intense that one nurse vomits in her mask and rushes out. The second goes running to get the doctors and the third, the original storyteller, turns to grab any bandages and antiseptic in the room. As she turns back, the woman is trying to get out of the bed. Her feet hit the floor pretty hard and there is the sound that was described as a wet towel slapping the floor, as the majority of the woman's infected and dead external and internal genitalia fell off. The last nurse screamed as the woman hit the floor face first and was unconscious. She was operated on again, had skin grafts and whatever they could to patch her back up. Yeah, not a nurse but a patient. I was a gunshot victim at 9 years old, 6 bullets, shattered elbow that now have 32 pins and screws holding my upper and lower arm together, permanent nerve damage in my leg and am unable to feel or move my foot. All along with losing my mother at the scene of the crime. I vividly remember identifying the perpetrator, out of a mock lineup in pictures, while in ICU. Paramedic. My first semester of medic school I responded with my preceptor to a car accident involving a young county sheriff's deputy and an older civilian woman. The older woman had both of her femurs fractured from the steering wheel but was lucky compared to the officer. The officer was responding to a call in the rain and lost control of her car, wasn't wearing a seatbelt OFC. Hit the civilian head on. Anyone in EMS, trauma, knows that the body in an unrestrained crash either goes up and over, ejection, or down and under and crumpled. This woman went down and under. Her head was snapped back with her face towards the sky, chin on the steering wheel. They had to pry apart the door and the dash to pull her out from the floorboard. She was only communicating in grunts, a good sign for brain injury. We could feel both sides of her rib cage were broken. She also had an obvious fracture to one arm and one of her legs was rotated too far to one side. We live very far from a trauma facility and 90% of our serious calls go by helicopter. However, as stated before, it was raining and our flight teams can't run with inclement weather. We were forced to take her to our local, mild boo-boos hospital. They were only capable of intubating her and applying pleural decompression for her double pneumothorax. She was taken by ground critical care to our regional shock trauma facility. We learned later that she also sustained a C2 spinal fracture, right under her skull, from her chin getting caught on the steering wheel, a brain bleed, liver laceration, and spleen laceration. Somehow she survived. We were all certain she wouldn't, especially since she couldn't fly. She's now up and walking around with supposedly minimal effects. She's also friends with. I'm a respiratory therapist. Not worst I've seen but definitely my most memorable, was a guy who attempted suicide by shooting himself under the chin and it blew his jaw off. Cricoid tracheostomy was done in field by EMTs. It takes a lot of guts to attempt a tracheostomy outside the hospital, so not dogging EMTs at all, but he had 4 or 5 gashes in his neck where they attempted to find his trachea. Guy looked like Venom with his tongue flapping around. PA stitched him up around the track and after heavy sedation, I was able to place him on vent but blood still bubbled at his track with every breath. Straight to OR and I saw him a few times in ICU. As a student, I saw a guy with rebar in his forehead that somehow split both lobes perfectly, and it was embedded in his corpus callosum. It was bandaged up and he looked like a unicorn. He was sitting up and talking normally. I'm still dumbfounded to this day how nonchalant that whole ordeal was. Not sure what his outcome was though. I was an anesthesia tech in 2012. We had a woman come in who had had a botched hysterectomy at a different hospital. The previous surgeon had nicked her colon before closing. She came to us 3 days later, septic. When the doctor opened her up, her entire abdomen was full of blood, pus and shit. The smell was so bad you could smell it through the walls. Every person in that room except the surgeon had to leave the room at one point to get away from the smell. We used larger suction canisters on wheels in the OR. I forget how many gallons they hold but we went through 3 or 4 in that case. As a reference, we normally used 1 per case and 2 for large, long cases if warranted. She was wheeled out of the hospital a couple days later. A fire crew member reversed the fire engine, the big heavy kind with a ladder, back up over one of the other firefighters' feet. Degloving injury meant the top half of the person's foot was hanging on by like 2 tiny muscles and an inch-wide strip of skin. Remarkably, they were conversing with staff, not screaming bloody murder or passed out like you'd expect. We had a guy in our hospital who, quite famously may I add, was impaled by a fencing post through his testicle and out just below the diaphragm. He never lost consciousness. Had a patient who underwent bariatric surgery and lost a ton of weight but still had a bunch of extra skin. Her sister bought her a Groupon for plastic surgery in Mexico as a birthday present, so she goes through with it. The plan a surgery and then set her up in a hotel room afterwards while she recovers and a doctor will come by and check on her every day until she's ready to return to the US. So she has the surgery, and it is extensive. I'm talking arms, legs, butt, boobs, abdomen, neck. This lady has incisions all over. They put her in the hotel room. And nobody shows up to check on her. No one brings her any medication or food. So she's just laying there, unable to move, in horrible pain. Then her incisions start to fall apart and she's leaking fluid out of them, called serious fluid, constantly. The only person who checks on her is Rodrigo, the night shift hotel employee who is 19 and speaks basically no English. This patient speaks no Spanish. She tells me that Rodrigo would try to clean her up, still no pain meds at all, and feed her. And he would just sit with her all night and hold her hand and cry because he didn't know what to do. Well, eventually she gains enough strength to try to get to the airport. Incisions are all still open and pouring out serous fluid, so she wraps up as best she can, gives all her cash to Rodrigo and has him stuff her into a can headed to the airport. She gets to the airport and they don't want to let her on the plane because she looks like she's going to die on the flight. Somehow she talks her way onto the flight, makes it back to the US, and then takes a cab to the hospital where she is immediately admitted for a multi-day stay. When I saw her about 3 months after this, her wounds are all closed but the scars, obviously, look like shit. I have no idea how this lady didn't die in that hotel room. She's lucky she had Rodrigo. and that poor kid is probably scarred for life. I told her it was the worst thing I have ever heard, and I hope I never hear a worse story. TLDR. Lady gets Groupon Mexican plastic surgery. Surgeon abandons her. Complications ensue. My EMT friend had a girlfriend who, when they were 17, broke up and she blew her face off with a shotgun. He said he came to see her in the hospital afterwards and everything below her eyes was just a bloody hole, mess. Her grandfather told her she should have finished the job. Another guy the first no had a gas jug in his car. He and his 12-year-old daughter pulled up to the pump and she went in to get some snacks. He lit a cigarette and blew himself up. Had third-degree burns on most of his body but lived, at least for a while after it happened. I didn't see him or hear about him after we tried to raise as much money as we could for him, so he might have eventually succumbed. Pharmacist here. Few years ago I worked on a regional burns ward and we had a patient come in with 90% third-degree burns. He ended up with bilateral leg amputations, one below and one above the knee, which took him down to about 70% burns. The consultant who amputated his legs said the only reason he survived was his legs were completely cooked and crispy, so the crap from his dead muscles didn't destroy his kidneys. He was apparently found by a dog walker in the embers of the fire he had been in all night the following morning. Not only did he survive, but he also vowed revenge on the person who pushed him into the fire that nearly killed him. I have no idea if he enacted that revenge. Rule of thumb for working out survivable burns tend to be as % burn plus age gives % mortality. So if you're 35 years old and have 90% burns, you're probably gonna die. This guy was very lucky. Also had another patient who had their gentleman sausage and 2 veg chopped off with bolt cutters. Yes, bolt cutters and not garden shears, and was left with a gaping hole where the aforementioned fun time equipment once was. They spent a few weeks under sedation on ITU before being woken up. They were discharged a few months later only to take their own life sadly. Worst part of that one was it was mistaken identity and the person who did it broke into the wrong house thinking he'd slept with his girlfriend. Incidentally, they did find his bits on the main road a day or so later after it was reported to the police by someone who actually worked on the ward the guy was on. Edit. Wording. Type 1 diabetic. Living quite isolated. He left work early on Friday because he felt a bit off. He didn't realize he was going into ketoacidosis. He must have lost consciousness somewhere at the start of the weekend. On Monday he didn't show up to work. Someone went to his house to check on him and immediately called an ambulance. It was really cold in his house because the heater had gone out. He was admitted to the ER with a body temperature of only 84 degrees and a pH of 6.78. Both values that are on the verge of being survivable. I think his boss's prompt phone call saved his life. Half a day later and he would have been gone. Actually, very recently, a 3-month-old survived being abused by his father with fractured ribs, a broken neck, and a fractured leg. He had a brother, but the father murdered him by abusing him as well. It made the local news. The infant is doing much better and I am so glad I got the opportunity to care for him. Very few things in this world make my blood boil. Child abuse is one of those things. IDK how I would have reacted if the father was in front of me. Okay. I was on call for transplant as a coordinator and we got an organ donor who was a 30-something-year-old sex worker who was beaten up and left for dead in an alleyway. They were non-responsive with very little brain activity, not to mention the physical injuries requiring life support. But because they had brain activity they were what we call a DCD donor. Donor after cardiac death, and we wait to see if they wake up or become completely brain dead. Well, they woke up. Then they sat up and started trying to take off all the equipment. Their heart started beating on its own again. They walked out of the hospital 2 days later. This is deliberately vague to protect anonymity. Eye doctor here. I saw an NYPD officer years after his accident, but he was shot in his Kevlar vest which fragmented the bullet and ricocheted up through his cheek, traveled through his eye, exited the eye into the orbital bone sinus and exploded off a part of his skull with brain matter. This disfigured man, even after reconstructive surgery, had a large hunk of cheek and skull missing, a plate in his temple. The most shocking part of his examination was that he was completely healthy, just disfigured. Cognitively normal. Vision was legitimately 20/20, and only some tiny bits of peripheral vision lost. Looking into his eye, you could see the entry wound of the bullet fragment. the trail through the vitreous gel, which lead directly to the exit wound. This thing must have been red hot because it cauterized the wounds going in and exiting. It was bananas, and still 25 years later one of the most insane cases of survived trauma I have ever seen. 11-year-old stuck by lightning. Saved by an aunt who did immediate CPR. Came in with his tennis shoes opens like flowers. Slightly melted. Nurse practitioner and former staff nurse for 12+ years. When I worked I had a guy blow all his fingers off with a quarter stick of dynamite. I had a guy who had a steel beam fall on his femur, quite literally, shattered it. The X-ray was fragments. Car accident where we got the only survivor of 5 people. Her pelvis was fractured. Right leg was bent sideways at the knee. Left leg was half missing. We ended up getting phone calls from Ems asking what color sock she had on because there were so many body parts laying all over the place. She lived but had diffuse axonal injury, brain dead. I am not sure what happened to her after that. As an NP, I work in urology. Priapism, hands down the worst, as getting shunted is not for the faint of heart. It's basically a scalpel or needle jammed into the penis to evacuate blood or blood clot. It can, and oftentimes is, done while awake. NICU nurse here. Baby was born with an undiagnosed congenital heart defect. A defect that if not treated will lead to death. Baby was discharged home. Mom took the baby to the pedi the next day because she felt like something was wrong. Pedi blew her off and said they'd follow up in a week. The next day baby came into the NICU basically DOA. There is duct in the heart that had kept her alive her first days, but the second day the duct closed and her little body went into shock. All babies have this duct that closes after a few days, and if their heart is healthy all is well. But some defects need the duct to stay open to stay alive. Her defect was lethal without a patent duct. I walked into the room that morning. The room was trashed. Baby swollen. Not even looking like a baby, with every drug imaginable being pumped into her body. You could barely even see there was a baby with all the machines hooked up to her keeping her alive. Her little body in shock, nearly shut down, bleeding from every hole in her body. She was sick for a very long time and doctors told mom she would never walk or talk or live a normal life. Well, this little baby is 3 years old now and visited me yesterday. She's beautiful, living a full life, walking and talking with only a scar on her. Pediatric nurse and 2 patients come to mind. A 9-month-old baby boy who was raped by mom's boyfriend survived a bowel perf and septic infection. And a 14-year-old girl who had been starved, abused and locked in a big cooler for years by her God's wolf parents. We had to amputate both feet. She was very sick from unmanaged diabetes, malnourishment and had a ton of wound infections and injuries, but survived. Thankfully her parents and the guy who raped the baby were all caught and prosecuted. I have a story of myself and how it was a miracle that I survived. I fell off a 200 feet cliff with no broken bones. And my knee was completely split open. I didn't even break my kneecap. 7 strokes, 2 collapsed lungs, a TBI and a skin graft later, but probably not the worst. I love reading things like this. Edit. Forgot to add TBI, traumatic brain injury, brain. I am a family physician with emergency and some ICU experience. One of the experiences that stuck with me was a patient with herpes encephalitis. That itself is interesting because we test CSF fluid, everyone we suspect for encephalitis and meningitis for HSV, and this was one of my only positives. She was unresponsive and on a vent. Neuro kept getting MRIs. You could see 1/4 the brain swell, then start losing its definition, then finally disappear, being replaced by fluid in less than a week. Neuro stated she will never wake up and work on comfort care. Days later the PT woke up with very little deficit, and Neuro kept saying, "This doesn't make sense based on the MRI." We discharged her to physical rehab. I work in the NICU, neonatal ICU. For those unaware, this is where the really sick term newborns and any preterm babies will be sent. As low as 23 weeks completed gestation. For reference, full term is 40 weeks. I've seen quite a range of things in just a few years. And this isn't necessarily about the patients, but their parents. The emotional turmoil that seemingly mundane things can have on parents is not nearly as recognized as I wish it was. I've seen many sad cases, but one was where a patient who had been in the NICU for months was needing surgery on their heart. To survive, problem was that the baby had many other medical issues as well. The mom had basically lived in the hospital throughout her baby's stay. She was there on rounds, slept there, took care of her baby throughout the day with the nurses. I don't remember seeing the baby without the mom being there. They had asked for second opinions, but basically no one could perform the surgery because the risk of death was too high. So the hope was that the baby would at least be able to breathe on their own and go home to at least be with the family before they passed. This dragged on for weeks. Would improve, then get worse, then improve, then get worse. One day, he suddenly coded and died. The medical team got the baby's heart to start beating the first time, but then it went back into an abnormal rhythm, so the baby needed compressions again, and the team did everything they could to keep them alive. Unfortunately, they couldn't. The worst part was that the mom and dad were there for the entire thing. They say the extreme measures the medical team went through to try and keep their baby alive over those 2 hours. The emotional toll that this takes on the families is the horrible. These are lasting unseen scars that they have to live with forever. Not only that, but then a lot of these families go home after trying to get their baby home for months, but without the baby. They also are then hit with the medical bill of having a greater than month-long stay. To suddenly lose a child, and then suddenly be over $1 million in debt due to medical bills, it's just unforgiving. I wish there was more we could do for these families, but some situations are just tragic. After an unfortunate trip and fall, a bloke arrived at Gloucester Royal Infirmary with a World War II artillery shell stuck in his rectum. Bomb squad were called. He survived, but his pride and reputation died right there. I saw a woman who had been stabbed in the neck with her own high-heeled shoe. Somehow, she just needed stitches and a tiny surgery. Stabbed in the heart. We got him back for a few weeks. Downstream complications are a bitch. My mom used to be an X-ray tech in the ER. They once had a patient who attempted suicide by drinking lye and lived. I'm a rescue flight mechanic in the Coast Guard H-60 helicopter. We rescued a 9-year-old boy who went through a large vessel's prop. He had a laceration across the entirety of his back that exposed his vertebrae and both body cavities. His left thigh had 2 large lacerations. His right arm had several large lacerations. His left ankle was cut in half and twisted off to the side. After flying him from the Bahamas to Miami, we dropped him off at Jackson Memorial. 2 days later, the hospital informed us he had survived. He was given over 3,000 stitches and multiple transfusions. His vertebrae was chipped, but his spinal cord was not cut. Kid was damn lucky to live. When I was in medical school, there was a patient in the emergency department with severe traumatic injuries to her face and what appeared to be defensive injuries on her arms. She didn't speak much English and was with an older man who claimed to be her boyfriend. She wasn't a patient assigned to me, but I was aware that the city I went to medical school in was a hub for human trafficking, so I brought my suspicion to the attention to the attending doctor, who managed to get the 2 of them separated and the patient connected to the social worker. The man ended up fleeing the and the patient ended up talking to a social worker and said that she was forced to work for that man and others after her passport was taken from her on arrival to the U.S. Her injuries were not life-threatening on their own, but they were pretty severe, and I think that, had she stayed in the situation she was in, there was a strong chance that she may not have survived. Definitely a scary situation, and I'm glad I said something, since I'm normally pretty introverted and was a little worried that I was just speculating. Teenage boy got hit in the head with a tree that came down during a storm. The neurosurgery service, pediatric ICU doctors, and the neurology service, my team, are reviewing the brain imaging together. Now keep in mind the scan looks really bad. So neurosurgery starts talking about a likely bad prognosis, and talking to the family about it. My attending, supervising doctor, pipes up with, actually I think he might do pretty well. Neurosurgeons look at him like he's nuts and say, are you kidding? Look at how bad this damage is. Why would you say that? My attending says, because when we went to examine him he kept trying to hit on our medical student. Medical ICU physician here. There are plenty of crazy stories on this post and others I've seen myself. However, the question is the worst thing. So, I'll just note that every week I'm on service I see patients that we term chronically critically ill. These folks have serious medical problems that live on a knife's edge all of the time. It takes nothing for them to tip over and decompensate, but usually prolonged ICU, hospital and nursing home stays after that. Often they bounce back to the hospital before ever making it home. This typically occurs with increasing frequency until ultimately they die from a complication, or they, more often their family, decide that enough is enough and focus on comfort at the end of life. This decision is usually made way too late when the benefits of palliative care cannot be fully realized. This is how a lot of people ultimately die, at least in the US. It typically results in a horrible quality of life and is very expensive, certainly a large part of the reason healthcare costs are so exorbitant. I'd highly recommend having conversations about what sort of care you deem appropriate for yourself and especially for your older and/or sicker loved ones before you find yourself in this downward spiral. In the middle of the night while doing my rounds, I walk into one of my patients' rooms and I see this liquid on the floor, so I turn on the lights. Turns out that liquid is blood. Apparently this woman had pulled out her femoral catheter and started bleeding out. She was laying on a plastic air mattress, so the blood didn't get soaked into the mattress and it instead dripped onto the floor. I rushed in and applied a tourniquet and dialed 911. Had I been 5 to 10 minutes late, this person would have easily bled out. They ended up making a full recovery. Edit for spelling. X-ray tech here. Saw a man that had gotten drunk and decided to sit with his legs over the platform on the subway. The train came and took off both his legs at the thigh and pulled him down and took off his right arm at the shoulder. His girlfriend tried to pull him back and she got her ankle snapped cleanly in half. It was like a perfect cut just above the joint. It was so eerie seeing them transfer him from the EMT stretcher and having his legs, arms stay back and get moved separately. He lost his legs, kept his arm, and the girlfriend recovered. After fixations were placed. Nursing student. My professor told me about a patient who had a massive AAA, abdominal aortic aneurysm, extremely fatal and also unpredictable, along with another aortic aneurysm that began in his heart and traveled up and dissected his carotid and subclavian arteries in his neck and shoulders. The force of the thoracic aneurysm in his heart was so much that it detached the veins and arteries from the muscle surface as well. He had to have something like a 40% arterial graft and resectioning. The craziest thing is a single AAA in the hospital is still likely fatal. This man had this happen at home and was transported by ambulance and in an MRI before they realized what happened. His family thought he was just choking on his dinner because he began pounding his chest before keeling over. He lived and was fully functional after about 8 months. The patient had history of multiple suicide attempts and self-harming. He'd drunk caustic cleaning chemicals and damaged his ability to speak and swallow. He had problems communicating and had a G-tube for nutrition. He had a urine bag because he had damaged his urethra and bladder with knitting needles and installation of chemicals. He was severely scarred over his whole body after attempting to immolate himself with gasoline, which also left him with several amputations. He was in the VA system, and I knew him over the course of many years. It was always distressing to interact with him. I couldn't satisfy his neediness, which he constantly demanded that I do. Once took care of a patient whose potassium level was greater than 10, double the upper normal. Lab radioed us while we were in the patient's room, watching their T waves in shock, and said that potassium wasn't possible and not compatible with life. Our doc took the radio and fired back, "It surely is, I'm watching it right now." We redrew and sure enough it was still greater than 10. The patient was sent to ICU but was completely walkie-talkie the entire time. Discharged in 2 days. When I worked as a student nurse in India, someone had been ran over on their belly, and the person reversed and ran over their legs. He was in so much pain but he managed to survive, and I was shocked because he had so many health issues too, and I think doctor were shocked too. Ex-nurse here. This was one of the ones I've seen in training. Definitely not the worst, but one of the more cringe in pain thinking about it ones. Poor lad, around 23 if memory serves, showed up in our with a work accident. He was using an angle grinder when the disc flew off, and grazed him in the thigh and scrotum, shaving off small bit of it, leaving his right testicle hanging out. Definitely not something you ever want to see. He was a good sport about it though once he got after the shock of seeing his own testicle, nudging his friends and asking, "Hey, you wanna see my nut?" and flashing it. It was sutured up and the damage was superficial and the testicle itself was unharmed. Nurse here. It was in the 80s. I was working in and a man came in. I still remember his name. With his coat on and his arms folded in front of himself. I was talking to the check-in clerk and asked the man what brought him to He opened his coat and his intestines started slipping out. He quickly caught them, stuffed them back in and held it shut with his coat. I remember asking him what time this happened. It happened about an hour prior to when he came in. I asked about the delay. Well, it was pot roast night and nobody in the world made better pot roast than his wife, and if he was going to die, he wanted to choose his final meal. He ended up being fine. EMT here. Severe electrocution. Yes, that's what it's called even if they don't die. He was working on a roof and a piece of gutter he was holding bumped a high voltage line that was supposed to be off. The hand holding the gutter was completely degloved, as were several spots on his torso. His whole body was covered in second and third degree burns. Somehow he was not only alive but conscious, but his airway was burned as in swelling shut. Fortunately, the paramedic I was partnered with was an ace at intubation and got a tube placed in time, and we got him to burn unit quickly. Last I heard, he survived. Thank you for watching. Please like and subscribe.